my name is Andrea Green. I'm a PN student, and today I'm going to be demonstrating administering a suppository, administering an enema, and then also changing a colostomy appliance. So I'm just going to start with my hand hygiene as I'm in my med room, and I have my provider orders and my MAR, and I'm just going to compare them. So first I'm going to make sure I have the right patient. So I have Shirley Coase, 54 female, date of birth 5/14/64. And I have Shirley Coase, 54 female, date of birth 5/14/64, and her doctor is Dr. Leo, room 211-1. So I have the right patient, so now I can go and make sure I have corresponding meds. So I have Docusate sodium 10 milligrams rectal suppository. Docusate sodium 10 milligrams rectal suppository, and that is to administer per rectum one time. Administer per rectum route, and it's for constipation. And then I have, if there's no results from the suppository within 12 hours, I am to administer a 4.5 fluid ounce enema. So I have my 4.5 fluid ounce enema, it's sodium phosphate, and then I have my sodium phosphate 4.5 fluid ounce enema. It's PRN if no results within 12 hours from suppository. So now that I have compared my MAR to my healthcare providers, I can start my first med check with pulling my meds out of my patient bin or the Pyxis. So I will start with my Docusate sodium 10 milligrams rectal suppository. This is Dulc, 10 milligrams rectal suppository. And I know I'm going to need lube with that and a med cup. And then I have my sodium phosphate enema. So I have my sodium phosphate enema. So sodium phosphate, and it is 4.5 fluid ounces and 4.5 fluid ounces. So now that I know I have the correct medications, I can go on to do my my second check. So again, we'll start with my suppository. So I have my Dulc suppository, 10 milligrams, Dulc suppository, 10 milligrams. And these would be individually wrapped in their own packages, and I will just put it into the med cup so I can later put lube onto it. And then again, I have my sodium phosphate for my enema, and it is 4.5 fluid ounces, 4.5 fluid ounces. So I can take that out of the box, and then I have my enema. I'm just going to place these meds here as I will need my bin later. And while I'm here, I'll grab my gloves. So now that I have my second med check complete, I'm just going to fill my patient bin and make sure I have the right patient. So I have Shirley Coase, 54 female, date of birth 5/14/64. Shirley Coase, 54 female, 5/14/64 for her date of birth. So I know I have the right bin, so I'm just going to place my materials in it, and I do know I have to do a colostomy change for this video, so I'm just going to put this in as well. So I have it all with me. Okay, so now I can make my way to my patient's room. I would knock on the door and close the door for privacy. Do hand hygiene and don gloves. Hi Shirley, how are you today? You're not feeling too well. You're feeling constipated? Yeah? Can I just get you to confirm your name and date of birth for me? Shirley Coase, 5/14/64. Shirley Coase, 5/14/64. And Shirley, do you have any allergies? You have an allergy to codeine. Okay, and I can see that on your MAR. We won't be administering codeine today, so we don't have to worry about that. So I'm just going to raise the bed to an appropriate height. Now that I've confirmed my patient, I can continue with informing her of the procedures we're doing today. So Shirley, the doctor's ordered for you today a rectal suppository for your constipation. So I'm going to insert that along your rectal mucosa. And it is going to be uncomfortable, but we'll try and make it quick for you. And while I'm inserting it, I'm just going to get you to take deep breaths and try and relax the best you can. So I'm just going to do my last med check. I know I have the right patient bin as I previously confirmed that. So again, I have my Dulc 10 milligram suppository, Dulc sodium 10 milligram rectal suppository, and I would put lube into the med cup. Enough to cover the tip of the suppository, and then to scoop with my finger so my finger is lubricated. I'm just gonna move this out of my way. So again, I've done hand hygiene, I have new gloves on. So Shirley, we're just gonna get you to roll to your side so I can insert the suppository, and if you could help me. Sweep it. Okay, and ready? We're just gonna roll. Okay, and usually we'd have them in left lateral or left Sims position for this. Usually left lateral. But these mannequins are kind of hard to maneuver. So we'll just try and get Shirley balanced against this pillow. Okay, so I'm just going to put down this lining now, and I already have my suppository ready. And I would scoop it with my finger and make sure there's lube on my finger and it's lubed well. Okay, Shirley, so we're going to insert the suppository now on the count of 3. I need you to take some deep breaths and just try and relax, okay? 1, 2, 3. Okay, and so take some deep breaths. Good. So I would dispose of the medicine cup and anything else, and then I would wipe with tissue paper or a wipe. And I would normally cover with a bath blanket, but because we're going to be going straight into the enema, I will do that when I do the enema. And they would stay in this position for 5 to 10 minutes. And I would give the patient the call light for when they need to go to the bathroom. So Shirley, are you okay? Are you comfortable? You're okay? Okay, and I'll come back and check on you in a bit. So we would go back, document, do hand hygiene, change our gloves, and then it's been 12 hours and there's no results from the suppository, so we're going to go right into the enema since there's been no results from that suppository. So I would do my med check again, which I've already done, don new gloves, do hand hygiene again. Again, the patient would actually be on their back, but for video purposes, I left them on their side. And I would confirm the patient again, make sure I have the correct patient, and do my med check so I have my enema that I've done. So Shirley, we have an enema for you because you there was no results from your suppository earlier. And again, this is going to be a little bit more uncomfortable, but this will hopefully help you go to the washroom. So I would lube the tip of my enema bottle, so I take off the cap, and I would lube the tip, and then I would insert it. So Shirley, we're going to insert this enema. It's going to, along your rectum mucosa, it's going to be a bunch of fluid that goes up into your rectum. And one thing I forgot to mention, with the suppository, they had good anal sphincter control, but for this enema, they do not have good anal sphincter control, so I'll be rolling them right back onto this bedpan, which I've placed in case it starts coming back right away. So Shirley, I'm going to insert the bottle, which is already lubed, on the count of 3, and I need you to take deep breaths and try and relax. Okay, 1, 2, 3, good, and try and relax and take deep breaths. So I would normally squeeze the bottle to make sure that all the liquid is into the rectum, and then I can take this out and dispose of it properly. And then we can roll Shirley back onto her back since she does not have good anal sphincter control. So we're just going to roll her back, making sure she's on the bedpan. Okay, and we have this chuck here just in case, just to keep the bed clean. And I'm going to put a bath blanket on Shirley to keep her sheets clean just in case there happens to be any spillage. So Shirley, I'm just going to place this blanket on you for now. And again, normally I would have done this as well with the suppository, but for video purposes, I just left Shirley on her side so I didn't have to do so many rolls with the mannequin. So I would give my patient the call light, make sure she's comfortable, and I would put her into a 90-degree angle to simulate sitting on the toilet. And I would go back to my nurse's station, document what I've done, the results, that there's no results for the suppository, and that I've administered the enema. I do hand hygiene, take off my gloves. And now the patient has buzzed for me to come back because it's been 5 or 10 minutes and they already need to go to the washroom. So I would lower the bed and Shirley's gone to the washroom. I've changed my gloves and I've done hand hygiene. I have the correct patient, and I will just remove the bath blanket. and throw it into the hamper or dirty laundry bin. So Shirley, I'm just going to roll you again as I remove the bedpan from underneath you. And making sure I try to secure the fracture pan from moving while I roll the patient. And normally, like, this patient would be able to help. Okay, so I'm just going to set this here. I would normally wrap it up in this, but we're going to keep it here as we'll be doing a colostomy bag change. I would clean Shirley with a wipe or tissue paper, help her clean up, and I would throw that in the trash, and then I would document my INO for the enema and the results. So now I can bring Shirley back onto her back. Okay, and make sure she's in a comfortable position. And I'm just going to grab these sheets down here that fell. So after this, I'll make sure Shirley's in a comfortable position. Make sure she has her call light and she doesn't need anything else before I leave the room. Tidy up the room, take off my gloves and do hand hygiene, and then document what I did and my INO. So now we'll be coming back into the room because we also have a colostomy appliance change. So again, I'll confirm my patient is Shirley Coast with her wristband. And I'm just going to tell her, so Shirley, I'm here to change your colostomy bag and your faceplate. So I'm just going to roll down her sheets. And I already kept that other pad underneath her, just because I knew I was going to be doing this. So I'm just going to put the other one around her sheets to protect her bedding. Okay. Okay, so I will just put this here, usually not be on the bedside table, but just for room purposes, as Shirley's kind of on this side of the bed. Before I remove her bag, I'm going to make sure I have all the necessary supplies, as I would hate to remove it and then be missing something. So I have the gauze for her stoma once I take off the bag. I have the measuring device for the faceplate. I have an adhesive remover wipe. I have my faceplate, and I have my colostomy bag with the clip already on it. I have scissors to cut my faceplate, and I have my adapt paste and my adapt stoma powder. So I have everything in my bedpan, so I can dispose of the old colostomy bag. And now this bin is turned into a wash bin for when I clean up the stoma. So Shirley, I'm just going to remove your colostomy appliances. So I would remove the bag and I would put it into the bedpan for disposal and then measuring INO and stuff. Just going to place that there. And then I would peel away at the corners of the appliance towards the stoma to make sure I don't put any pressure on the stoma. And then I would dispose of that. And now that that is clean, I have my warm water. And I would just clean around the stoma, and then the stoma itself as well with this, and make sure that is all cleaned up. So now that it is clean, I'm just going to move this out of my way, and I'm going to measure what I need for size. So I need it about 1/8 of an inch larger than the stoma, and that does look like 45 millimeters is the right size. So 45 millimeters, and I'm going to cover her stoma with gauze just to stop any leakage from the stoma while I prepare the appliance. So I can open the faceplate, and I have a pencil that I can trace the size I will need. So again, I said that is 45 millimeters. And again, sorry, I've changed my gloves and I've done hand hygiene before I start this procedure and after cleaning up the stoma and removing the bag. So I have new gloves and I've done hand hygiene while I begin this. So I'm just going to trace the size I need. Okay. And then I can cut it out. So while I cut this out, I normally like converse with my patient or client and make sure they're doing okay and ask them if they need anything else while I'm here. Making sure they're comfortable in their stoma, they're not experiencing any pain with their stoma, which they shouldn't be. This is for Shirley. She has a newer stoma, so she might be a little uncomfortable since it is new, and that is why I'm helping her with this appliance. So eventually I would do some patient teaching on how to change her own appliances. So I'm just going to make sure this is cut. And when we cut this, we want to make sure that we don't have any jagged edges. For video purposes, I'm not going to be too fussy on this just because this is a more difficult face plate. But in the clinical setting, I would make sure there was no jagged edges whatsoever. It was a smooth cut, as we don't want it to dig into the stoma and cause skin sores. So now that I have that cut out, I'm just going to make sure that that's going to fit her stoma. And it will fit, so that's good. Okay, so I'm just going to get my powder ready, my paste. Just going to clean this up. Okay, so I'm going to put the powder on her stoma. So I put this powder around her stoma. I can remove the gauze now, and I can peel the paper back off, and I put the paste around the inner ring to help it stick to the patient. So now I'll place this over the stoma and press it down. And then I have my bag with the clip already on it, and I will place it onto the faceplate. Make sure I hear those clicks to know that it's in place. And then I could hold my hand here, rubbing the corners for 1 to 2 minutes just to make sure that adhesive really sticks. And now I can clean up my patient. So now that her colostomy bag is changed, I will change my gloves, do hand hygiene, document the colostomy appliance change, make sure my patient has her call light. I would remove this, the blue, or the pad from underneath her as well, and dispose of everything. Do any eye and nose from the colostomy bag. Make sure my patient is comfortable and covered. Make sure she doesn't need anything, have the call light with her. And then as I leave, make sure the side rail's up, lower the bed, hand hygiene, remove gloves, go back to nurse's station, and I would document everything I did. And eye, nose, and colostomy appliance change, and then that will conclude this video.